most cancer centers take a patient that comes in and treats them as if they only exist as a cancer. And so the entire focus is on treatment of that cancer. And they don't really understand that there are a lot of side effects from chemotherapy, a lot of side effects from radiation, a lot of side effects from the cancer itself. And so despite the fact that patients are doing poorly as a whole, their cancer is getting smaller. And so that's what the majority of the cancer centers in the United States focus on, is yes, we cured the cancer. Unfortunately, the patient may not have survived the cure. That doesn't sit very well with me. My entire focus is to help the patient go back to living a completely normal and healthy life, to minimize the effects of all the cancer therapies, and to make sure that the cancer therapy that is given is customized just for that patient. So in that regard, I try to take a lot of different approaches. I am very conscious of the nutritional aspects of health and wellness, and I recognize, and I've always recognized, that nutrition plays an incredibly large role in how well a patient does, both in terms of developing their cancer, but also how well they tolerate cancer therapy and how well they recover from the cancer therapy. So nutrition is one of the very large pillars of my practice. Some of the other things that I practice is I'm very broad-minded. If a patient wants to try some herbal product or something that would be considered somewhat experimental or off the mainstream, I welcome that. As long as a patient is not harming themselves with their behavior or their choices, I would be absolutely delighted to help them with their choices and guide them in making the right choice and also in monitoring the cancer.